Ever wondered how doctors tell one childhood rash from another? Let's break down a classic clinical question.
Okay, here's our question. Which infection is the most likely cause of a maculopapular rash in kids?
The key clue is maculopapular. That's just a mix of flat spots and small raised bumps. To find the right answer, let's use a process of elimination. It's the easiest way.
First up, chicken pox. That rash is vesicular. Think little blisters. So it's not our answer.
What about scarlet fever? Well, its rash has a very specific sandpaper-like feel, so that's out.
Fifth disease has that famous slapped cheek look. A totally different presentation. Another one down.
Now, rubella gets tricky. It also causes a maculopapular rash, but there's a key distinction here.
While they're similar, measles is just the textbook example for this type of rash in children.
So, after crossing off all the others, we're left with just one clear answer.
And there you have it. The correct answer is measles.
Remember, it's the rash plus high fever, cough, and pink eye that really points to measles. Okay, let's pull this all together. A quick visual guide should make these differences really stick. See how different they are side by side, from blisters to sandpaper to that slapped cheek look? It just goes to show you, with so many lookalikes, a fast, accurate diagnosis is absolutely everything.